We really have a potential health crisis on our hands.
We just had a 3-day lockdown. Today's the first day back.
In Kinshasa, it's 12 million people in the city and with a lot of vulnerable people.
What people really urgently need in this time is food, of course, soap and information.
Also in the Netherlands, we face many challenges in terms of battling COVID-19. Mortality rates are high.
What we perhaps need most in Afghanistan is to slow down and contain the spread of COVID-19.
The main issue is to have enough masks and protecting suit and also gloves.
70% of our population is poor and living below $1 or $2. So,
although the situation is challenging here, if we really want to overcome this global crisis, we must support the world's most fragile countries now more than ever.
And as a humanitarian organization, we need to help those that need our help most.
Uganda can build on their experience to prevent Ebola. So they are very strong at prevention, and that is important because the healthcare systems are not that strong.
In this project, we help with the training of health workers that work in clinics, hospitals, but also those that work in communities. We help with providing equipment, supplies, and technicians.
Last week we distribute materials to the government.
What long-term opportunities might arise from the crisis? What we see is strengthened health systems, especially when it comes to a similar threat in the future.
At the longer term, we are also looking at livelihood programs. We are looking at social and economic consequences and try to address these challenges.
I am very proud about the team. They really responding professionally.
We do a lot of our work through our greatest asset, and that's our strength, and that's our staff. Our staff are our greatest strength.
I really hope that one of the consequences of this crisis is the realization that universal health coverage for all countries is not a luxury. It's not necessarily a need. It is an absolute must.
And it's essential to support the vulnerable people in this world.
COVID-19 has now evolved in a global challenge, and supporting national health systems in the most fragile settings is the only way to create a lasting breakthrough and to avoid full-blown catastrophe.
I think all of us can agree that we're in this together. I think all of us agree that pandemics do not stop at the border. Universal health coverage should be all citizens of this Mother Earth.